Well, not just the new variant, which has been called a variant of concern now by the WHO, and that's the latest update. It's called the Omicron now, as the super mutant also rises. Europe too is in the grip of a fourth wave. Infections are higher than ever. Several countries are imposing lockdowns, and Europe now accounts for 3 in every 5 cases across the globe. The World Health Organization fears there could be as many as 500,000 more deaths by February 2022. I filed this report earlier. The COVID pandemic is far from over. In fact, it's rising with vengeance across Europe.
Probably by the end of this winter, pretty much everyone in Germany, it has sometimes been said, somewhat cynically, will have been vaccinated, recovered or died. But it's true. With the highly contagious Delta variant, this is very, very likely.
COVID restrictions are returning. In Germany, it's nearly 9 million people who are not allowed to leave home except to go to work or shop for essentials. Austria has announced a complete lockdown from the 22nd of November. It is the first European country to declare compulsory vaccinations from February 2022. Hungary, Belgium and Netherlands are also mulling shutdowns as the virus rages. On the 8th of November last year, Europe reported the peak of the year with 2.87 lakh new cases, which went down to around 40,000 on June 19, 2021. On the 21st of November 2021, new cases jumped again to 3.3 lakh, almost 61% of the world's new cases. Germany surpassed the United Kingdom in terms of daily deaths, and the gap is only widening. Germany now reports over 200 daily deaths. The crisis in Russia is deadlier, with the country reporting more than 1,200 deaths every single day, in spite of a decline in new cases. Germany had only 8,000 new cases on the 1st of October, but on the 21st of November, the number jumped 6 times to 49,206. It was almost the same story in the UK, in Russia, Netherlands, Australia and Italy. So what's really causing the surge? Is it waning immunity or vaccine resistance?
It is winter time. When people gather indoors for festivities, the surge is expected to get worse. When a large number of individuals have infection in the community, there will be a proportional rise in the number of hospital admissions. Therefore, the hospital systems are being strained and lockdown has already been instituted in certain regions.
The World Health Organization is worried. It fears there could be as many as 500,000 more deaths by February. Deaths are being seen even in highly vaccinated countries.
COVID-19 is surging in countries with lower vaccination rates in Eastern Europe, but also in countries with some of the world's highest vaccination rates in Western Europe. It's another reminder, as we have said again and again, that vaccines do not replace the need for other precautions. Vaccines reduce the risk of hospitalization, severe disease and death, but they do not fully prevent transmission.
India too is concerned, given the opening up of international travel and a sudden rush to make full use of it.
This is definitely a time where the guard cannot be lowered. This is definitely also the time when the panic should not set in, the fear should not be set in. We should move in this phase with responsibility. Responsibility in terms of the COVID-appropriate behavior, which is still relevant. Responsibility to ensure that the adults are vaccinated. And responsibility on the part of the government to ensure that the surveillance, genomic surveillance and the preparedness is not diluted at all.
India is taking solace from the fact that 99% of COVID cases are courtesy the Delta variant that ravaged India in the summer of 2021. The same variant was first detected in India. That there is immunity to this variant, given the widespread exposure, and no other variant or lineage has so far been more dominant, is what is making India more hopeful. In New Delhi with Milan Sharma, Sneha Mordani for India Today.